Today is a memorable day for me. For the first time, I am trying prechopper and nucleus sustainer of same length, that is 1.8 millimeter from the last bend. Let us observe this totally unedited surgery. First, the main incision. The main incision is being placed at around 11 o'clock with a 2.8 millimeter steel keratome. This is phenocane, which contains lignocaine, tropicamide and phenylephrine. Anterior chamber is filled up with 2% hydroxypropyl methyl cellulose, and it is applied over the cornea for better visibility. The side port is made on the left side of the main incision about 3 clock hours away. And now watch the incisions. Can you see very little oozing of blood from the wounds? And this is good. This is good for healing of the wounds. Now watch rhexis with Oertli forceps. Once you learn Oertli, you will not go back to needle. No. Control is much better with the Oertli forceps or microrhexis forceps. And now hydrodissection is done and the nucleus is rotated. And now see the use of prechopper and nucleus sustainer. This is the prechopper. The front edge is the cutting edge, the bottom is rounded, and through the side port is going the nucleus sustainer. Both the nucleus sustainer and the prechopper are of same length, that is 1.8 millimeter from the bend, and see how beautifully it divides the nucleus into pieces. And now one heminucleus has been divided. The antechamber became shallow, so I inject visco and rotate the nucleus, go so that the other undivided heminucleus is now in the inferior aspect, and this heminucleus is also divided. Now we have got 4 pieces out of the nucleus. And now we just have to go in and pick up each nuclear piece and emulsify, as if you have cut a cake into 4 pieces and you are eating up each piece of cake with help of ultrasonic energy. It is as simple as that. You don't have to chase the pieces, it will come to you. You just have to touch the instrument at the apex of each nuclear piece and apply vacuum and power. And now with the handpiece itself, I am trying to remove some cortex. You may refrain yourself from doing this. I have gone through some complications, and now I know how to do this. And my ball tipped nucleus sustainer protects the posterior capsule from coming to the tip. But it takes some courage to do this, and this may not be necessary for you. You just can use bimanual irrigation aspiration to remove the cortex. And now going to hydroimplant an intraocular lens. The main wound is enlarged by one cut, which is about 0.1 millimeter. And now here goes the intraocular lens. Both the haptics have gone into the capsular bag. The irrigating probe irrigates goes behind the lens, and whatever substance sticks to the optic of the intraocular lens is removed by the irrigating jet of fluid. The posterior capsule is also polished, and now we are done. This is moxifloxacin. Side port is closed by corneal stromal hydration, and then the anterior chamber is nicely formed with the help of a 23G Simcoe cannula. See how it is done. At this time, only irrigation and no aspiration. And check the wounds, no leakage from nowhere. So it is done. Thank you very much for your attention. Hope this video will encourage you to try my newly designed prechopper and nucleus sustainer, where the nucleus sustainer is having 1.8 millimeter tip length.